a blanket shutdown to achieve a temporary reduction in cases is certainly not a viable long-term strategy for any country. People are starting to understand the disease now. We certainly have understood a lot about the disease that we didn't have any idea. Nobody ever saw anything like this. The primary purpose of a shutdown was to flatten the curve, ensure sufficient hospital capacity, and develop effective treatments and therapies to reduce mortality. And we've done that, but it can come rearing back when you least suspect it. We did the right thing initially. We saved millions of lives. What we did the right thing. But a permanent shutdown would no longer be the answer at all. A small shutdown of certain areas, but we don't want to do that. Small shutdowns can be very helpful, but not for long periods of time. We understand what we're dealing with now, but it's a very complex situation. And I can only say, thank heaven that we are so advanced in what we're doing in terms of vaccines and therapies. We now know a great deal about the virus and how to treat it and who it targets. Almost half of the deaths come from less than 1% of our population. Think of it, half of the deaths, really a tremendous number, half of the deaths come from less than 1% of our population, those living in nursing homes and assisted living facilities. The average age of those who die from the illness is 78. We've announced very strong measures to protect those who are most vulnerable. The scientific path forward is to protect those at highest risk while allowing those at lower risk to carefully return to work and to school with appropriate precautions. I'm once again urging the American people to protect their dear family and friends and anybody who's elderly, especially if somebody's elderly and they have heart problems, if they have certain illnesses. Diabetes is a very bad one, having to do with what we're discussing. But you want to protect the elderly and socially distance. Wear a mask if you cannot socially distance, and practice vigorous hygiene. Everyone, even healthy young people, should be taking extraordinary care to avoid infecting those at the highest risk from this terrible disease. The elderly and those with chronic health issues have to be protected. In the current hot